what if the exact thing you do to stay fit is the very thing destroying a $1,500 investment in your own body?
Oh yeah, it happens all the time.
Right. It is this fascinating and honestly incredibly common modern dilemma because you walk out of a clinic, having just had this cutting-edge wellness procedure, and you're holding a glossy brochure that proudly boasts zero downtime.
And if you're an active person, someone who really optimizes their schedule, your brain immediately translates zero downtime into zero physical limitations.
Exactly. I mean, the impulse is just to head straight from the clinic to the gym for a heavy lifting session, or maybe jump into a high-intensity interval training class on your way home.
Well, the logic makes perfect sense on the surface. I mean, we've basically been conditioned to believe that recovery only applies when there are stitches, scalpels, or general anesthesia involved.
Yeah, like if I'm not bleeding, I'm fine.
Right. If you are told you can go right back to your office desk, the natural assumption is that your body is instantly ready to perform at maximum athletic capacity.
Which is where so many people accidentally sabotage themselves. As we often discover in the world of regenerative medicine, minimal downtime for your daily life does not mean your biology is ready to run a marathon an hour later.
It really doesn't.
So welcome to this custom-tailored deep dive designed specifically for you. Today's mission is to unpack the post-procedure restrictions for the O-shot.
Yeah, which is a really popular treatment right now.
It is. It's a platelet-rich plasma, or PRP, treatment utilized for vaginal health, improved sensitivity, and treating things like urinary incontinence. And we're zooming in on why high-impact cardiovascular exercise and heavy lifting are temporarily but absolutely off the table immediately following the procedure.
Yeah, it's a critical window.
Okay, let's unpack this. Minimal downtime on a brochure doesn't mean what you think it means.
No, not at all. To really grasp the rules, we have to look at the invisible world of what is actually happening inside the tissue. I mean, the procedure itself is incredibly quick, usually under 30 minutes, and it relies on this brilliant biological premise.
Starting with just a standard blood draw, right? Like from your arm.
Exactly. They take that blood and place it into a centrifuge. It spins at a really high velocity to separate the red blood cells from the plasma.
So you're left with just the good stuff.
Right. The goal is to isolate the platelet-rich plasma, concentrating those platelets to levels way above what you would normally find circulating in your bloodstream.
Platelets are essentially the first responders of your body's healing system. When you get a paper cut, they're the ones rushing to the scene to, stop the bleeding and start the repair.
They are the ultimate biological task force. So when this concentrated serum of platelets is carefully injected into targeted areas of the vaginal region, they don't simply sit there in a pool of fluid.
They get right to work.
Oh, immediately. They are packed with growth factors and cytokines.
Okay, let's break that down. Cytokines.
Yeah, cytokines are basically microscopic chemical messengers. The moment they are introduced to the tissue, they start sending out massive, complex biological signals that stimulate tissue healing. And the primary goal of this signaling is to trigger a process called angiogenesis.
Okay, I want to pause on angiogenesis because that is a massive concept. We were talking about the formation of entirely new blood vessels.
Right, from scratch.
You are fundamentally prompting your body to rebuild and rejuvenate its own vascular network in that specific area. And that new blood flow is what improves the tissue response, the natural lubrication, and the structural support.
What's fascinating here is that the creation of those new vascular pathways is the entire foundation of the procedure's success. But it requires a tremendous amount of cellular energy.
It's not a passive thing at all.
No, it's precise biological orchestration.
So if I am picturing this, it's sort of like planting delicate new seeds in a garden. You've just planted the seeds, the platelets, to grow a lush new lawn.
Yeah, a vascular lawn.
Right. And you wouldn't immediately go do wind sprints across that fresh dirt. Or actually, it's maybe more like managing a massive biological construction site.
Oh, I like that analogy.
The concentrated PRP is the demolition and construction crew you just hired. The cytokines are the foremen walking around with blueprints, shouting orders to the local cells. And the angiogenesis is the crew actively laying down brand new, highly complex plumbing.
That is the perfect way to visualize it. And if you have a crew actively laying down fresh, delicate plumbing, you wouldn't intentionally send an earthquake through the construction site before the concrete has even had a chance to dry.
An earthquake. That's a great way to put it.
Because the initial days following the injection, they are not a passive waiting period where the body is just resting. It is an incredibly active, highly vulnerable biological event. The platelets are establishing a microenvironment.
Which means the drive home from the clinic, completely changes in context. You aren't just done with a medical appointment. You are actively transporting a delicate biological construction site in your pelvis.
You really are.
And the sources are very clear on the timeline for this. Strenuous exercise, which specifically includes heavy lifting, high-intensity interval training, running, and jumping, must be avoided for the first 24 to 48 hours.
And they really emphasize that committing to the full 48-hour window is the safest choice for protecting that cellular work.
So it's just 2 days. That's the golden window.
Yes.
Yeah.
The restrictions also extend to any activity that puts direct, sustained mechanical friction on the pelvic area.
Like what, specifically?
Cycling or taking a spin class are prime examples. The sheer mechanical load and the physical friction of sitting on a bike seat for 45 minutes are incredibly disruptive to freshly treated, highly sensitive tissue.
I am struggling with the recovery timeline here, though, and I want to play devil's advocate for a second on behalf of the listener.
Sure, go for it.
If I feel completely fine 12 hours after the appointment, like no pain, no real discomfort, it is incredibly tempting to go do a heavy leg day.
I see this a lot.
Right. Because if my body isn't sending me pain signals to stop, what is actually happening at the cellular level? Furthermore, if the entire point of the O-shot is to trigger angiogenesis and increase blood flow, wouldn't a heavy, heart-pumping workout actually help?
It seems logical, yeah.
Shouldn't we want to pump as much blood to the area as humanly possible to speed things up?
So the idea that more blood flow always equals better healing is a very common misconception. We really have to separate beneficial systemic blood flow from disruptive mechanical strain.
Okay, disruptive mechanical strain. Walk me through that.
Well, when you engage in a heavy heart-pumping workout, your cardiac output absolutely increases. But you are also subjecting your body to immense physical stress. High-impact cardio creates massive shear forces within your tissues.
Explain shear forces in this context. We're talking about the physical jostling of the anatomy.
Yeah, think about the mechanics of doing a set of jump squats. Every time you land, the impact creates microscopic shock waves through your pelvic region.
Oh, yikes.
Right. And the newly injected platelets need a stable, calm environment to lock into the tissue and release their growth factors effectively. If you are creating high-impact shear forces, you can physically disperse the PRP fluid away from the highly targeted injection sites.
You are essentially washing away the construction crew before they can even unpack their tools.
Exactly. You aren't just sending beneficial blood, you are sending physical trauma to an area that is trying to orchestrate a very precise cellular rebuild.
That makes so much sense. But what about heavy lifting? Because weightlifting doesn't necessarily involve jumping around.
That's true.
If I am doing a slow, controlled, heavy deadlift, I'm not creating those bouncing impact shockwaves.
No, you're not. But heavy lifting introduces an entirely different but equally destructive physical force: intra-abdominal pressure.
Intra-abdominal pressure.
Yeah. Let's break down the mechanics of a heavy lift. When you prepare to lift a significant amount of weight, whether it's a deadlift, a heavy squat, or even a heavy leg press, you instinctively perform a Valsalva maneuver. Oh, right, where you take a deep breath in, hold it, and violently brace your core muscles to stabilize your spine.
Precisely. You are creating an internal corset of pressure so your back doesn't give out.
Right, otherwise you'd get crushed.
But that massive internal pressure has to go somewhere. When you brace your core and bear down, you are drastically increasing the pressure inside your abdominal cavity, and that pressure pushes directly down onto your pelvic floor.
Oh, wow. I never thought about the physics of that. You are quite literally squishing the exact anatomical area that just received the delicate fluid injections.
Yes, you are unnecessarily loading the treated area from the inside out. You are forcing the pelvic floor muscles to contract violently against mucosal tissues that are currently swollen, filled with extra fluid, and just trying to heal.
So it physically displaces the PRP.
It does, but it also creates micro-traumas in the tissue that distract your immune system. Instead of focusing all its energy on the angiogenesis you paid for, your body now has to divert resources to heal the unnecessary strain you just caused by lifting heavy weights. That is wild. We also need to mention the water-based restrictions, because for anyone who prefers the pool, the rules are even stricter.
Much stricter.
Swimming, water aerobics, or even just soaking in a hot tub or taking a long bath, those are restricted for usually 3 to 7 days. And this isn't about mechanical impact, right?
No, it's primarily about the risk of infection. The injection sites are tiny, but they are still microscopic breaks in the skin barrier.
Soaking in communal water or even your own bathtub before those micro wounds have fully sealed is just an unnecessary infection risk.
Definitely. And the heat from a hot tub or a very hot bath also causes vasodilation, the widening of blood vessels, which can severely exacerbate post-procedure swelling and lead to significant discomfort.
Let's get into the reality of that discomfort. Say someone ignores the 48-hour rule. They feel fine, they think zero downtime applies to their CrossFit routine, and they go hit a heavy workout.
It happens.
What are the actual physical consequences they are going to experience when they wake up the next morning?
The most immediate and noticeable consequence of overexerting the treated area too soon is a drastic increase in inflammation. We need to distinguish between normal biological response and trauma response, though.
Right, because some swelling is normal.
Exactly. Mild swelling, a slight feeling of fullness, or temporary tenderness are completely expected for the first 1 to 3 days. That is the biological construction crew arriving on site. But intense exercise pushes that normal response over a cliff.
Because the sources specifically warn about crossing the line into extreme swelling, intense throbbing, localized redness, and persistent sharp pain.
Yeah, you have essentially overloaded the tissue's capacity to cope with the fluid volume and the healing demands. The localized trauma from the workout causes your body to flood the area with inflammatory fluids to protect the strained muscles.
Completely overwhelming the delicate PRP process.
Right.
Here's where it gets really interesting, though. Because if you do overdo it, or even if you are just experiencing normal, mild soreness, your very first instinct in our modern culture is going to be to reach for the ibuprofen.
Oh, absolutely.
If I wake up with a throbbing pain, I am immediately grabbing a handful of anti-inflammatories to get through my workday.
Which is the absolute worst thing you could do for your results.
Wait, really? The worst thing?
Yes. Patients are strictly instructed to avoid all NSAIDs, non-steroidal anti-inflammatory drugs. This includes ibuprofen, aspirin, naproxen, and medications like Aleve or Advil.
For how long?
For anywhere from 3 to 7 days after the procedure.
We really need to unpack the why here because it feels completely counterintuitive. You were told not to take anti-inflammatories because your body actually needs its natural inflammatory response to heal.
Precisely. The whole point of injecting the PRP is to intentionally trigger a localized, controlled inflammatory cascade.
But inflammation gets such a terrible reputation in wellness culture.
It does, but it is the primary architect of new tissue. When platelets release their growth factors, they rely on specific inflammatory pathways, specifically the production of prostaglandins, to signal the stem cells and start building those new blood vessels.
So what happens if you pop an Advil?
Well, if you swallow an NSAID, the medication doesn't know you want it to ignore your pelvis. It chemically blocks the enzymes that produce those prostaglandins system-wide.
You are chemically turning off the exact biological communication system you just paid a medical professional to turn on.
You are firing the construction foreman on day one. By blocking the good regenerative inflammation, you are stalling the angiogenesis process before it can gain any momentum.
The irony of this cycle is just massive. I mean, imagine the scenario. You go to the gym 24 hours early because you want to be healthy and optimize your fitness.
Right.
That intense mechanical exercise creates the wrong kind of disruptive traumatic inflammation. Your body starts throbbing in pain. To fix the pain caused by the gym, you take an ibuprofen.
Yep.
The ibuprofen then shuts down the right kind of biological inflammation that the PRP relies on. In an attempt to be super healthy, you've entirely ruined the biological investment.
It is the ultimate self-sabotage cycle, born out of good intentions and a misunderstanding of how cellular regeneration actually works.
So what can you take if you're hurting?
If you do experience discomfort, which is normal, the approved protocol is to use acetaminophen, commonly known as Tylenol.
Because Tylenol works differently.
Yeah, acetaminophen relieves pain through central nervous system pathways without blocking the peripheral inflammatory enzymes the platelets need to do their job.
Got it. The sources also mention you can use ice packs to manage the initial swelling, but there's a very specific technique to it, right? You shouldn't just sit on a frozen block of ice for an hour.
Definitely not. You apply it for about 15 to 20 minutes at a time, always using a cloth barrier.
Because if it's too cold for too long, it's bad.
Right. The goal with the ice is to take the edge off the throbbing and manage excessive swelling, not to completely freeze the tissue. Extreme, prolonged cold will constrict the blood vessels too much and essentially put those active platelets to sleep.
Slowing down the very metabolism you're trying to encourage.
Exactly. Short intervals of cool therapy are perfectly safe. Deep freezing is counterproductive.
So we have established a fairly robust list of don'ts. Heavy lifting and high-impact cardio are absolutely out for 48 hours. Cycling is out. NSAIDs are banned for a week. Pools and hot tubs are off limits for a week.
It sounds like a lot when you list it out.
Yeah, if you are an active person whose mental health relies on daily movement, it sounds like a prison sentence. What should you do during this time? How do you safely transition back into your routine?
Immediate post-procedure movement should definitely be limited, but we aren't suggesting strict bed rest in a dark room.
Okay, good.
Gentle, low-impact movement is perfectly fine and actually beneficial. A light, unhurried walk promotes general systemic circulation, which keeps healthy blood moving throughout your body.
Without creating those destructive shear forces or intra-abdominal pressure spikes in the pelvis.
Exactly. Just keeping the heart rate reasonable, avoiding heavy sweating that could irritate the injection sites, and avoiding anything that jostles the anatomy.
And then after the 48 hours.
Once that strict 48-hour window closes, you can begin to resume normal activities. But the critical keyword is gradually. You don't go from a gentle 10-minute walk on Tuesday to attempting a 1-rep max heavy squat on Wednesday.
Test the waters first.
Right. Test the waters with lighter weights or lower impact cardio. And the most important guiding metric: you stop immediately if swelling, throbbing, or sharpness increases during or after the workout.
Listen to your body.
Yes, your body will give you real-time, undeniable feedback if the tissue isn't ready for the load.
But there is a twist in the source material that we absolutely have to cover. While the clinicians are telling you to avoid the squat rack and the spin bike, there is one highly specific exercise that they insist you absolutely must do to optimize the longevity of the O-shot.
Oh yes, Kegels.
Yes, pelvic floor exercises are not just a casual, optional recommendation. They are a vital structural part of the aftercare protocol.
Patients are encouraged to commit to a daily 10-minute Kegel routine to actively strengthen the underlying pelvic floor muscles.
I love the analogy of a home renovation here because it makes the relationship between the shot and the exercise perfectly clear. Think of the O-shot as fixing the upholstery of an antique couch.
I love this.
You are improving the surface tissue, you are increasing the blood flow, and you are making the mucosal lining healthier and much more responsive. But Kegels are reinforcing the solid wooden frame underneath that upholstery.
Right. It doesn't matter how premium the new fabric is. If the wooden frame underneath is weak and degrading, the entire couch is going to sag.
Exactly. You need both the biological surface renewal and the muscular structural support for the results to hold up over the next 12 to 18 months, which is the typical expected lifespan of the shot's benefits.
If we connect this to the bigger picture, the biology of why these two things work together is fascinating.
Oh, so.
Muscles are highly vascular tissues. When you actively build and tone the pelvic floor muscles through Kegels, you are creating a denser, more robust capillary network within that muscle bed. That stronger, highly vascular muscle layer acts as a powerful foundation, constantly feeding and supporting the newly formed blood vessels in the mucosal tissue just above it. The mucosal tissues and the muscles are actively talking to each other, sharing resources.
Oh, wow. It is a complete positive feedback loop. The stronger muscles provide a better vascular highway to support the new blood vessels from the PRP, and those new blood vessels provide better oxygen and nutrients to help the muscle stay strong.
That's the synergy.
But that loop only exists if you actually do the work. And the clinical data we reviewed on this specific synergy is striking.
The numbers really highlight the importance of the patient's active participation. Clinical data shows that patients who combine the biological boost of the O-shot with dedicated daily pelvic floor exercises experience a 40% longer period of symptom relief compared to patients who rely entirely on the PRP injection alone.
40% weight, that is a massive return on investment. If the shot naturally lasts for a year, a 40% boost means you are getting almost 5 extra months of vitality and relief, purely from dedicating 10 minutes a day to flexing a muscle while you sit at your desk or drive your car.
But again, you only get to build that muscular frame if you let the delicate upholstery dry first.
Which brings the entire conversation full circle back to why those initial 48 hours of rest are so utterly non-negotiable.
You are setting up the foundational environment for that 40% extension to even be possible. If you disrupt the construction site early on with heavy lifting, you ruin the angiogenesis.
And no amount of Kegels later on will be able to rescue a vascular network that was never allowed to form properly in the first place.
Exactly.
So what does this all mean? Let's distill all of these complex mechanisms into a clear roadmap for the listener. The O-shot is a brilliant, scientifically sound utilization of your body's own regenerative machinery. But it is not magic, and it requires your absolute cooperation.
You have to respect the 48-hour delicate phase.
Yes. The zero downtime marketing applies to your ability to safely walk out of the clinic and go sit at a computer, not your ability to set a new personal record at the gym. Swap the heavy deadlifts and the intense cycling classes for a light walk.
And manage any mild discomfort with a cloth-wrapped ice pack and Tylenol.
Keeping NSAIDs far away from your body so the platelets can actually perform the biological inflammation you need. Keep out of the pool and the hot tub for a week to protect against infection and extreme vasodilation. And finally, embrace those daily pelvic floor exercises to build the structural frame that will make your investment last.
You know, reviewing these protocols really reframes how we view physical recovery as a whole. We live in a relentless culture that constantly demands we push our bodies to perform, heal, and bounce back on demand.
We really do. We're always looking for a biohack that allows us to skip the rest phase entirely.
Right, but regenerative medicine, at its core, teaches us a deeply humbling lesson. Sometimes, the absolute most productive, biologically advanced thing you can do for your body's cellular growth is simply to give it permission to rest.
Wow.
It forces us to ask a broader question.
Yeah.
How often do we unknowingly sabotage our own biological healing in all areas of our health simply because we are too afraid of sitting still? The human body is extraordinarily capable of rebuilding itself, provided we have the patience to just get out of its way.
A profound and necessary thought to end on. Thank you so much for joining us on this custom deep dive. We hope this exploration into the cellular construction site clarified the why behind the strict rules, empowering you to confidently protect your investment and achieve the absolute best possible results. Keep asking the smart questions, listen closely to what your biology is telling you, and most importantly, stay curious. We'll see you next time.